Good afternoon. Thank you, Governor. Echoing the Governor's remarks, on behalf of our entire team at the Rhode Island Department of Health and across state government, I would like to offer our sincerest sympathies to the families, friends, and loved ones of the Rhode Islanders, the first Rhode Islanders who have died from COVID-related illness last night and today. As we've been saying for many weeks now, coronavirus is a serious infectious disease, and we must brace ourselves for the reality that there will be more deaths. There is work that everyone can do to address this. The Governor has shared very strong guidance about the need, the absolute imperative for people to respect social and physical distancing rules, not to get together and socialize, and to stay in quarantine if you're supposed to be in quarantine. What I will relay is some clarification on what it means to be in quarantine. If you are ordered to quarantine, you've returned from a neighboring state and need to be in quarantine for 14 days, that means that you are ordered to stay inside. If you need to get food or pick up medicine, you need to call someone who can do that for you, or you need to use delivery services. Thanks to the Governor's leadership, we have services and will continue to provide services to support people that need to do this. We know it's not easy, but effective quarantining means staying inside and letting someone else do those essential services for you. We will continue to provide that clarity so people know exactly what we are referring to with quarantining. Unfortunately, we've seen too many instances where Rhode Islanders are not following the vital mandates that we have been saying for a month. And so, as noted, the Governor has had to issue these stricter mandates that are critical. We need 100% of the Rhode Island population to follow these directives. This is a critical part in helping to determine how high that curve is that we will go with hospitalized cases. We need to make sure that our healthcare system can withstand it, and it happens by people following these recommendations 100% of the time, 100% of the Rhode Island population. Not 50%, we need 100% of everyone doing that. In terms of data, as the Governor said, we have 36 new cases. This brings our total case count to 239. 29 people are in the hospital. That's compared to 28 yesterday. People, please note that we're working to continue to have current data available to you every day, particularly knowing how quickly it is evolving with the number of cases increasing substantially. I also want to make another note on data. We have been reporting quarantine numbers every day. We know that these numbers can change because big groups can go on and off quarantine, as we discussed yesterday. As of today, 2,500 people are currently instructed to self-quarantine in Rhode Island. However, that number does not include the travelers and people from New York and, as of today, from the other states who are now instructed to quarantine. We want to make sure that everyone has clear understanding of what we mean when we're saying quarantine. And as I mentioned, it is staying inside, staying home, having someone else care for those essential needs that are needed. Our next big area of focus is going to be stepping up our efforts to protect the residents, patients, and staffs of nursing homes. This is an extremely serious health situation we are dealing with in Rhode Island right now. And this is a time when we need everyone to be acting responsibly and thinking about the welfare of the entire state. That goes for all of us in all settings, nursing homes, congregate settings, and in our own individual homes as well. For every Rhode Islander, if you develop symptoms of COVID-19, even if you have not been tested, you need to stay at home and isolate. Even if you have mild symptoms that seem like a cold, consider that COVID-19, self-isolate right now, and remain at home until your symptoms have been gone for at least 3 days. A key component is being aware of who you have been in contact with, direct contact with, and making sure that those persons are informed as well to self-quarantine. That's going to be a critical approach as we go forward that we at the Rhode Island Department of Health and across state government are looking to build capacity to further enforce. If you think you need medical care, call your doctor. Do not just show up. If you have symptoms of COVID-19, everyone you live with and people you have been in close contact with while you were sick should again quarantine for 14 days. These are all important directives that we will continue to relay. We want to be able to say that we are able to change the height of the curve that we're talking about. The strict guidance that the governor gave today is what's needed to help us get there so that 100% of Rhode Islanders are following and everyone is doing their part to help us get through this together.